Okay guys, let's start on the last part of the skeleton. This be the appendicular. Mostly that's the legs and the arms, and the shoulder girdle, and the pelvic girdle, the hip bones. Alright, the pectoral girdle, aka the shoulder girdle. You can see this structure consists of three major bones. There we have the humerus. Here we have the scapula, that right there, and this guy is going to be the clavicle. So the shoulder joint is fairly loose, gives you a lot of freedom of a range of motion. Now that little rounded area that you see the humerus sitting in is going to be the glenoid cavity. We'll see that again coming up in just a second. Now, let me tell you something about the format on this PowerPoint. You have a lot of these drawings that have no labels on them. They're going to be super for you to print out and use to quiz yourself, to prepare for the quizzes and for the midterm. So I would definitely do that if I were you, especially if I want a good grade. There's the clavicle. Now, the clavicle has this rounded end. I don't know if you guys can see. And this end here is rather flat. This end is going to go to the sternum. So that's the sternal end. This end, this rounded end, is going to attach to the acromion process on the scapula, and that's going to be the acromial end. And you can see it right there, same thing. And now you can see it articulated. There's the acromion process. And you can see how this guy goes, and he's going to attach to the sternum. Okay, so on here, this is a key landmark right there. That is the spine. This guy is shaped kind of U-shaped like that, and this guy down here is kind of not nearly so deep. There are muscles that sit there, and so we call these guys fossa, F-O-S-S-A, because they're kind of a bowl-like depression. The one above the spine is not surprisingly called the supraspinatus. 1 minute. Let me make sure I got this right according to the way they've got it. Supraspinous fossa. Sorry, guys. This one down below would be the infraspinous fossa. The muscle that sits there, we'll find out later, is the supraspinatus and the infraspinatus. But right now, let's just focus on bones. That is the acromion process right there. Sometimes it's just called the acromion. And this guy is called the coracoid. We'll see more about him. So there's everything that we talked about. The spine, infraspinatus. These guys are not on your exam. It's not on your lab list, so it's not on your exam. There's the coracoid and the acromion. Now that's looking at it from the posterior, okay? You're looking at it from the back. This is what it looks like from the anterior. Again, there's the acromion, and here's this guy. This guy is kind of long, shaped like that, and someone thought it looked like a crow's beak, and that's why it's called the coracoid process. There's that glenoid cavity. We'll show you a better picture of that. Now here I said we had infraspinous and supraspinous fossa. There is a fossa here. There's a muscle that sits here. The muscle that sits there is the suprascapularis, and this is going to be called the subscapula fossa. Again, medial, lateral borders. These guys are not on your list, so there you can see the glenoid cavity. That's where the head of the humerus is going to fit in. And you can see all this. You can see these fossas. You can see how they kind of curve inward. All right, let's keep on going, guys. Okay, so next thing on our list is going to be the humerus. This guy has got a lot of parts, so This is going to be the anterior view, and this is going to be the posterior view. I can also tell which one of these is lateral and which one is medial. Now this is the same bone flipped around, okay? This is the head of the humerus. We just saw that the glenoid cavity, the head fits in like that. So whichever side the head is facing has got to be the medial. And so it is. We're going to need that information in just a few minutes when we get to it. So we've got these two bulges in the bone. You can see it better over here. These guys are called tubercles. The one that is higher up is called the greater tubercle. The one that is lower down is called the lesser tubercle. That's pretty easy. Now, if you notice, there's a groove right here, and we call that the intertubercular groove. Okay? If you also look, you'll see where this guy kind of bulges out right there. That's for the attachment of that big, strong deltoid muscle. So that is going to be called the deltoid tuberosity. Tuberosities and tubercles, not the same thing, guys. Okay. I said this was the head of the humerus, and so it is. Now, underneath everybody's head, there is a neck. So there is the neck of the humerus according to the anatomical folks. There is the neck of the humerus according to the surgeons. And it's just two different, I mean, they consider it to be two different places. We have to know both of them, guys. So the anatomical neck is going to follow the outline of the little ball shape. The surgical neck is going to be down below on the actual shaft of the bone. Okay. Right here, we got this rounded thing right there. That's, guys, going to be called the capitulum. This guy right here that has this kind of V shape is going to be called the trochlea. Those are going to be important because that's where the bones from the forearm are going to fit in at. And we'll talk about those forearm bones in just a little bit. Now, this is the front. I don't know if you guys can see, but there's little pieces of bone that kind of protrude out like this on this guy. So when you bend your arm, when you flex it, that thing has got to go into a hole or else it's going to press on the bone and get broke. So we have holes in the bones here, and those are for these guys. Here's another one for you. Well, you've already had a coronoid, you've already had a coracoid, and here's another coronoid. So this is a coronoid process, and so the hole it goes in right here is going to be the coronoid fossa. On the back, we have this real deep hole because we've got a real big, and this guy kind of shaped like that. So we call that one, this is the olecranon process, so this would be the olecranon fossa. Okay, these guys right here are going to be called epicondyles. They're called epicondyles because they're up above where this guy connects with the next bones. Now, these guys have their own special name depending on whether they're medial or lateral, but we just got finished telling you how to tell medial from lateral. So this is going to be the medial epicondyle, and this guy is going to be the lateral. And of course, over here, this would be the medial, and this would be the lateral. Okay, I think we talked about the capitulum. I think we finally got finished with the humerus. There's not a lot on there. You can look on the list. And again, you've got it all labeled for you right here. So use the blank ones to study with. Again, the surgical anatomical neck, that little line right there that kind of follows the outline. There's the radial fossa, but it wasn't on your list. So the coronoid fossa, and on the back, of course, we've got the olecranon fossa. Okay, so now let's go to the radius and the ulna. The radius and the ulna are the two bones that are in the forearm. For the most part, the ulna is going to be the main bone that's going to attach to the humerus. For the most part, the radius right here is going to be the main bone that attaches to the wrist. These other guys are in support. So here's the radius and here's the ulna. How can you tell? This guy's got a little button top right there. Also, the radius is going to be larger at the bottom since it's going to be the one that articulates with the wrist. So I know this is the radius. I know the radius is on the thumb side. And I know the ulna is on the little finger side. This obviously is going to be the head of the radius. See it right there. This is going to be the head of the ulna. And if you think that is the neck of the radius, you're right. Sure, where are you going to find a neck? Under a head. So, let's see. The only thing we got left, well, two things. If you notice, the radius kind of bulges out right there and then goes back to being more or less parallel. That's going to be the radial tuberosity. Yeah, there's muscles that attach there. The other thing is, it's hard to see down here, but there's a little piece of bone that sticks out like that. And that's going to be the styloid process. You can actually feel those on your own wrist. If you go to the thumb side and that little bone that pokes out to the side is going to be your styloid process on the radius. And on your little finger side, you can feel it also. And that's going to be styloid process of the ulna, which they have one too. Now, as far as the ulna, the head we've got, and what else do they want you to know? Okay, they want you to know that's the olecranon process, or you can call it just the olecranon, and this is the trochlea process, or excuse me, the coronoid process. The only other thing we've got on there is this guy called the trochlear notch. So I'm going to try to draw this. There's the olecranon, and we're looking at it from the front. Comes down, and there's the coronoid. We've got a ridge that runs here, and it goes downward that way. And if I were to draw it from the side, it would look like that. That is going to be the trochlear notch. Why do we have that? Because you remember the trochlea is V-shaped, so we need a V-shape to fit in there. Alright guys, that's everything on the radius and the ulna. That's everything you got on your list. So, and again, you've got the labels right there. There's a good one. You can see the coronoid. You can kind of see the trochlear notch coming down here. It's kind of hard to see. It's very apparent, but it is kind of V-shaped in cross-section. There's where these guys articulate with the humerus. Again, the medial epicondyle and the lateral. What else? It's actually going to be the left arm. Radial tuberosity. Anyway, you guys can look at that. We've gone over everything that's on there. Okay, so the hand. This is good, but honestly, I would rather do it from the other side because I think it's going to be easier for you. Okay, I'm going to draw on this one. This is the front, and this is the posterior. How can I tell? Because if you remember in standard anatomic position, the thumb is always on the lateral side. So that could not be the left. Well, no, it couldn't. It couldn't be because these guys would be crossed over each other. Anyway, take my word for it for right now. Okay, so I'm going to go through this. These guys are called the metacarpals. That's because the wrist bones are called the carpals. These guys are really easily named. Look at that. If you start on the thumb, it's 1, 2, 3, 4, 5. First metacarpal, second, third, fourth, fifth. Done. It's that simple. Now these guys starting here are the actual fingers. Because remember, this is the palm. Now, there's our four fingers and there's our thumb. These bones are called phalanges, Phalanges. This phalange is closer to the body than the other two, so I'm guessing it's going to be called the proximal phalange. So right. And so this would be the first proximal phalange, the second, third, fourth, fifth proximal phalange. Okay, this one is further away from the body, so I'm guessing that's going to be called the distal phalange. Exactly, that's the first distal phalange. Now you come over here and we notice that there's actually 3 bones instead of 2. Well, this one is the furthest out, so these are the distal phalanges. And so there's the first, second, third, fourth, fifth distal phalange. Well, what do you call these guys in the middle between the proximal and the distal? You call them the middle phalange. 1, 2, 3, 4, 5. The fingers and the metacarpals are a piece of cake. They are so simple. Okay, you just have to be able to count to 5. Now, the wrist bones are called the carpals. The wrist bones can be a little tricky. I know a mnemonic that I learned a long time ago that works perfectly if you do it right. If you do it wrong, you're going to mess up. So there are 8 carpal bones. There's 1, 2, 3, 4, 5, 6, 7, 8. Now I'm doing this from the front on the anterior on purpose because that's the way that my mnemonic works. Notice that we've got 2 rows too. You've got a proximal and a distal row, right? So I'll start here. She likes to party. Try to catch her. So that would be scaphoid, she. Lunate likes. Triquetrum, 2. Party, pisiform. Try, oh, she likes, yeah, try, that's going to be trapezium. 2. Trapezoid, catch, capitate, her, hamate. Now, notice something, guys. I got to start on the thumb side on the first and go all the way through this list. And then I've got to go back to the thumb side and then do this one over here. So what if I tried it on here? She likes to, I'm going to do it. You might be able to get it, but then again, I wouldn't even try it from there. What if I do it this way? She likes to party, try to catch her. You've just missed it. Now, if you don't like that, then by all means find your own. There are other mnemonics. Some of them are profane, so I won't use that. It's vulgar. And you may not want a mnemonic at all. However it works for you. I'm telling you something that I've used all my career, and the feedback I've got from my students is it works good. Of course, unfortunately, this one is the back side. We're looking at the back of the hand, so I can tell because the thumb is facing inward instead of outward. But it shows you everything there. Okay, guys, that takes care of the hand, and so we're finished with the arm and with the shoulder girdle. So down here, pelvis. Okay, we know this is the sacrum, is part of the vertebrae. Okay, so we're not talking about this guy. These are our hip bones. There's actually 3 bones there, but if you refer to them as a group, they're either called, get ready for it, the coxal bone, which is going to be C-O-X-A-L. You could also call it the innominate bone, which I've never heard that outside of school. This is going to be our pelvic girdle. This is where the legs are going to attach to the body. Okay. As far as what we've got to know on this is a deep cavity, much deeper than the glenoid fossa. This is where the thigh bone is going to fit in. This guy is called the acetabulum, A-C-E-T-A-B-U-L-U-M. It's on your lab list. And this big hole right there is called the obturator foramen. So as far as this whole bone, that's all we have. We'll go into the individual bones, the 3 bones. Of course, there's the pubic symphysis, that fibrocartilage that separates them in the front. Okay, coxal bone. Now, somewhere about right here, it's hard to see on these guys because these are photographs and not actual models. We have a division. Those are our 3 bones, guys. This bone is called the iliac bone. This bone is called the pubis or the pubic bone. And this bone is called the ischium or the ischial bone. There's the 3 bones that make up. You can see the acetabulum again. So let's go and see what we've got. I wonder if I've got, well, these are small. I wonder if I can make them bigger. Apparently not. Okay, we'll do it in here. Okay, so here I need to know lateral from medial. Well, the legs attach on the lateral side of the hip bone, right? You don't have legs coming up inside the pelvis and attaching on the inside. These guys have got to be lateral, so that tells me lateral. I also know that the pubis is going to be in the front, so this is going to be anterior. So again, this would be anterior and this would be medial. That's what it looks like on the inside. See, no place for the hip bones to attach there. Okay, we need to know that because we've got a bunch of spinal lines that we have to know. This guy, if you looked at it from the top, it kind of comes to a point. So anything like that is going to be called a spine. So we've got these spines. I'm going to try to show it over here because these guys have got all the list. This guy, I know it's the anterior, right? So that's going to be posterior. Since I know that's the anterior, then I know that's going to, and I know it's down below. Trying to get these guys for you. This is in the front and it's low down, so it's going to be anterior, inferior iliac spine. This guy up here is in the front, but it's higher up, so he's going to be anterior superior iliac spine. The very top of the spine is called the iliac crest. Okay. Now, in the back, past the iliac crest, I've got another spine. This one is higher up and it's in the back, so it's going to be posterior superior iliac spine. And finally, you got this part down here, which is in the back and lower down. It's going to be posterior inferior iliac spine. And this area in here, it's kind of hollowed out like that. We have a big muscle sits there, and that's called the iliac fossa. So this whole bone is going to, well, actually, I think it goes more like that. I'm sorry. Anyway, this whole bone is going to be called the ilium. All right, now the ischium. I don't know if you guys can see, but this guy is big and kind of rough there, and it's kind of pokes out. You can see it a little bit. No, you can't. Can't see it on this side. That guy is called the ischial tuberosity. That's what we sit down on, guys. That's all it is. Okay, right up above it, you can see this little triangular shaped piece of the bone, and that's going to be called the ischial spine. Okay, and below the ischial spine, you've got this notched out area. That's going to be the lesser sciatic notch, which is right there. So this big notch right there is going to be the greater sciatic notch. All right, guys, let's go to the pubis. So as far as the pubis is concerned, very small bone, and we've only got just very few things we need to know. It actually is shaped kind of like that. And so this part is going to be called the superior ramus of the pubis. This part is going to be called the inferior ramus of the pubis. And the only other thing they ask us to know is this area right here, where we're going to actually have the pubic symphysis, that piece of cartilage, is going to be the pubic tubercle. Yeah, we got another tubercle. Can't be helped, guys. All right, guys, that is everything on the hip bone. And again, you guys can practice. Maybe you can resize that. It's a little bit small, I think. Okay, so you can see all this, the anterior pelvis. You see where everything articulates, the pubic bone, the symphysis, the obturator, acetabulum, everything we've already talked about. Okay, posterior pelvis, basically. Oh, you can see the ischial tuberosity. Whoops, sorry guys. You can see the ischial tuberosity. I lost my drawing pencil. Oh well. You can see the ischial tuberosity right there, and the ischial spine. So great lesser sciatic and greater sciatic notch and all that. Male versus female pelvis. This is definitely going to be a male pelvis. This is going to be a female pelvis. Why do you say that? Because this one is wider and is meant to have babies pass through it. Also, look at those. Those are those ischial spines. Notice how far away they are. Look at them in the male. They're very close. There's no babies going through there. If you look at it from the side, I don't know if you can really see that well here, but the there's actually a difference in the angle right there. It's got a wider angle for the female than the male pelvis. And yeah, you can see a little bit. Let me just draw it. So if I were looking at this from the side, this in the male pelvis, that sacrum goes a little bit further in, whereas on a female pelvis, it's going to be a little bit further out. Again, everything about the female pelvis is intended and designed to allow babies to get through there. And the male pelvis isn't designed so like that, so it's got a different structure. All right, guys, the thigh bone, aka the femur, and that's a different bone. That's called the patella. That's that little piece of bone that floats on in front of your knee. But let's do one thing at a time. So if you thought that that would be the head of the femur, you are right. That is the femoral head. Fovea capitis. I don't know if you can see it on there. Yeah, a little bit. There's a little circular area on the head that's kind of depressed. That's called the fovea capitis. Now, this is the anterior. This is the posterior. How can you tell? Well, this area where you see this cartilage is going to be in the posterior side. Can I tell medial from lateral? Same way. This guy has got to fit, so the bone goes up like that and fits into the acetabulum. So this has got to be the medial side, and this has got to be the lateral side. Okay. I'm saying that because, well, we'll need it down here. Okay, here we have these guys, and let me tell you the most common mistake folks make. The most common mistake they make is thinking these are tubercles, and they're not. They are tubercles on the humerus near the head. On the femur, these guys are trochanters. The one that's up higher is the greater trochanter. The one that's down lower is the lesser trochanter. I'm not even positive. Scratch out the linea aspera. I don't think you're going to be able to see that on there. I mean, if it was in the lab, I could show it to you because you could see it, but it's hard to see that on a diagram, so we're not even going to do that. Okay. Now, this right there, those guys are condyles. These guys are above those condyles, so those are epicondyles. You can't confuse those. These guys are not interchangeable. So if I said that this guy always points to the medial, this is the medial condyle, and that's the lateral condyle. See, next thing on your list is the neck. Well, there's no two necks on this. Everybody is agreed that that's the neck of the humerus, or excuse me, of the femur. Wow, we are moving along, guys. And that's everything they've got on the list for you for the femur. They're being really nice to you guys. And as I say, this is the patella. It's your kneecap. It's a bone that sits right in front of where the knees comes in with the lower leg. So here's everything. Medial condyle, we've done all this. Yeah, see, there's a linea aspera, but you really can't see it on. This is just not good enough. So I'm taking that off our list because it's just not. And of course, none of that stuff's on there. So there's your study pages. The trochanters again. There you can see the fovea capitis really well. Okay, the condyles and epicondyles. No more on that. We're good. There's the patella sitting in front of. You can see that little dot right there. That's the patella. Um, that's all that's really on that. And just actually just know it. Okay, guys. More of the same. Okay, it's time to get to the lower leg bones. There are two. This big, huge thing, this is your shin bone. It's called the tibia. This lesser one is going to be the fibula. You know, I'm getting better at writing with my mouse. It's about time, huh? Ooh, look at that break right there. It's bad. Anyway, we'll talk more about that in the lecture about fractures too. These guys don't turn over each other. That's not what they do. These are the two parts of your ankle that you can actually feel through the skin. And there's a tuberosity that you can feel just underneath your knee joint. You can see it's very big. So let's go through what we got. The intercondylar eminence is this thing right there. So this is what the top of the tibia looks like. This is a condyle, this is a condyle, and this is between the condyles. So it's going to be the intercondylar eminence. Which one is going to be medial and which one's going to be lateral? Well, honestly, I would probably just look to see which side the fibula is on. The fibula is on the lateral part of the low leg, and this is going to be the medial. So I can say this is the medial condyle and this is the lateral condyle. If you want another way of doing that, the side that you see this thing on is going to be medial. That's another way of doing it. Now, let's go ahead and give these guys a name because they've been nameless too long. So this guy that's on the tibia is always going to be the medial malleolus. I know it's a big long name, but it's one of those things we just have to deal with. Okay, and this little area right here that kind of bulges out, we're going to call that the tibial tuberosity. Okay, guys, the only thing left on the tibia is the anterior crest, and it's going to be a line that goes down here, so let's scratch that off again. I just don't think you're going to be able to see it well enough, and I don't want to try to put you guys in a situation where you're bound to fail. Okay, so that leaves us with the fibula. Fibula, we only have two things. We have this over here, and that's going to be the lateral malleolus because it's the only one that's left. This guy up here near the head of the tibia is going to be the fibula head. We're just about got this thing down, guys. So you can see all of that. There's that anterior border. You can see it a little bit, but I don't think so. Because not everybody has high resolution monitors. We're just not going to do it. Tibial tuberosity, the condyles. Interesting. Here you can see a little bit better the top. You can see those condyles, and you can see that line right there on top of it. There you can see the medial malleolus. That's always the tibia. The lateral is always the fibula. All right, guys, it is time for us to get to the feet. Now, I'm going to go ahead and do the exact same thing. These guys are your toes. And guess what you call these bones? You call them phalanges, just like you did the finger. And that is this is 1, 2, 3, 4, and 5, just like the fingers. Okay, so this is the first proximal phalange. That's the first distal phalange. Second proximal, second distal, second middle phalange, and all the way through to 5. That takes care of all of the toes. These guys, these bones here that connect the bottom of the tibia to the foot, these guys are called tarsal bones. So that means these guys are called metatarsal bones. Okay? Alright guys, so all we've got left is our tarsal bones. Now unfortunately I don't have any great mnemonic for you guys, so let me just do what I've got. This guy, which is the heel bone, is called the calcaneus. That's his name. This guy right next to him is called the talus, not the tarsal. Don't get it confused with the other, but talus, T-A-L-U-S. Okay. Now this is where we actually get a break. This guy kind of looks kind of boxy, so we're going to call him the cuboid. Now this is really good. These 3 bones here all have the same name. These are all cuneiform bones. Now the big toe, if you look down at your foot, we'll find that it's medial. So that is the medial cuneiform. That is the lateral cuneiform. I wish they'd just call that the middle, but they don't. They call it the intermediate cuneiform. Well, what about this guy? Well, the only thing left is the navicular bone. That's it, guys. It's just that simple. And we've got all the stuff to show you. We kind of luck out with the fingers and toes. And they just got some disarticulated. That has got it for the skeletal system. I appreciate your kind attention, folks.